today I'm going to speak about a study that we conducted in Italy and in Hogent, so with Professor Croce and Professor Claudia Claes. So we are talking about promoting social inclusion and the perception of priorities in activities provision by support staff. So nowadays we know that social inclusion is a desired outcome for people with intellectual disabilities, and nowadays many organizations and service providers they have in their mission the promotion of social inclusion for the people they serve. But yet research showed that it might be insufficient unless service managers are also committed in exercising their leadership to inculcate new ways of working to reach this outcome, so the outcome of social inclusion for the people with intellectual disabilities. And often, we also saw from some other studies, like the studies of Claudia Claes of 2012, that supporting organizations are promoting activities that have a low congruence with the assessment data collected on clients and consequently on personal outcomes. So much more times the assessment is not really, does not find always an application in the practices and in the support that they are given to the person. So the aim of this study is to investigate whether the mission of the organization found a relevant correspondence in the perception of a priority of support provided by staff related to social inclusion or to taking care. So we took these two dimensions. And so the method, so we had a sample of 113 support workers that they were belonging to 35 different organizations all around Italy, so there were quite a representative sample, not each one from each region, but they were quite representative of Italy. And so you can see all where they were located in Italy. And the instrument that we used, it was an instrument developed in Ireland by the McConkie and Collins questionnaire. And this instrument was developed to measure the priority of perception regarding two different tasks. And it was created for measuring the perception of the professionals relating to two kinds of tasks, so the taking care task and the social inclusion task. It's composed by 32 items and it's divided in two subscales. Each item, so a working task, we can say, had to be rated from 1, that it means low priority, okay, 2, medium priority, 3, high priority, or an A, so not applicable. It's not applicable to my job, each working task. And so a comparison was made between the rating given by staff to the activities in the two different areas of support. And we used an analysis that I'm going to show you. So for example, these are some examples from the questionnaire of care tasks. So for example, so supporting clients in dealing with epileptic seizure related to care task, or giving the medication at appropriate time, or for example, clients getting an evening meal, or clients dressing appropriately, or clients taking physical exercise. So it was really meant and focusing on caring task. Okay, social inclusion tasks. So these are some of the items. For example, increasing client choices about what they want to do during the day, or for example, clients going to the local shop, or clients phoning or texting to their friends. So we had these two different lists, 16 items per each list, relating to social inclusion tasks or taking care tasks. So these are the results. These are the results that are regarding the organization commitment and the mission of the service. So we can see on orange, it's not from yeah, it's not from Netherlands, but it's yeah, football team. Yeah. Okay, so we can see that all the 35 service providers, they had in their mission the social inclusion. So it was nominated in the mission that the service, they had a name on promoting social inclusion for the people they were working with. And just 7.3% they had in their mission the taking care of the person. And then when we got to the results of the instrument, so we saw that 73% point 9, it was the percentage of the high priority task that they were given. So the much more of the high priority was given to taking care than just 30% it was given as high priority to the social inclusion of the persons that they were served by these organizations. And we measured it with non-parametrical statistics because the sample was not normal, and we saw that they were significantly different, the scores. When we got to the percentage of working tasks that were rated as not applicable, so we saw that there were much more tasks of social inclusion that they were not rated as not applicable than the taking care tasks, but the statistic that it was not significantly different, but it was as double of the others. And then when we analyzed the number of tasks that they were rated as a high priority by more than 50% of the staff, so we saw that the taking care tasks were rated as high priority by more than 50% of the staff, and they were 12 on 16. And when we went to measure and to see what about the social inclusion, we saw just 2 tasks. They were rated as high priority by more than 50% of the staff. And these are the results, okay, of the number of tasks that they were rated as not applicable by more than 50% of the staff, and it was just one that it was rated as not applicable to my job, and it was a social inclusion task. So the results, what we can get from these results, that despite almost every organization has in its own mission the promotion of social inclusion, the priority of the task perceived by the operators was significantly preponderant to care tasks. So even the non-applicability of task was preponderant to social inclusion than on taking care tasks. So about the utility of this study, getting to the conclusion, we can say that it was possible to deliver services that are oriented to produce social inclusion outcomes, and they are focusing on the perception of the role of the support worker, but a different perception of the staff regarding the provision of activities could promote the achievement of inclusive and quality of life outcomes. So the robustness, yes, as I told in the beginning, so maybe if we had a service from each Italian region, maybe it would be more representative, but it was quite already robust sample. The understanding is that maybe there's a lack of shared knowledge about the importance of social inclusion outcomes in the service providers or the people they're working. And on the other hand, we can say that there was a lack of alignment of the support activities that they were provided with the mission. So because the services they want to promote, and every service was devoted to promote the social inclusion of the people, but then on the other hand, we saw that it was not corresponding in the activities. So it really links to what we were saying before, so that it's really important that we keep in mind that our assessment has to help us to define and to reach the outcomes. And if the outcomes they are defined in quality of life, it's easier to have a broader field and the specified outcomes to be reached for the person. About the relevance of this study, so we can say that there's a need of sensitization regarding the social inclusion outcomes for people with intellectual disabilities in the support staff. But also, on the other hand, we can say that it's really important that we start to think on how to restructure the way that we support the people and the way at the organizational level, so that we can have really activities that are connected to the mission and to develop quality of life outcomes for the people that they are serving. And okay, that's all. And these are some greetings from Brescia and the Garda Lake.